An extra 500,000 workers affected by Victoria's Stage 4 lockdown will be able to access financial support with changes to the JobKeeper scheme announced overnight. The federal government will ease eligibility rules announced just 3 weeks ago. It means businesses facing a fresh downturn may be eligible for payments beyond September.
And even more industries will scale back their workforces at the weekend as Melbourne struggles to contain the coronavirus outbreak. We'll be joined shortly by the Treasurer Josh Frydenberg. But first, Steph Ferrier is in Melbourne for us and political reporter Matt Doran is at Parliament House. Good morning to both of you, starting with you, Matt. Take us through these changes to JobKeeper.
Well, there are two key elements here relating to the eligibility criteria for the wage subsidy scheme. When a business is presenting itself to the tax office, to the federal government, and saying that it wants this wage subsidy, it has to prove that it's going through a certain amount of financial hardship or that its turnover has diminished to such a level that it's required or that it's eligible for this support to start flowing. The change that is being announced today is that a business would only have to prove that it has suffered a diminished turnover over the last few months, the last 3 months, rather than a longer period of time. And that is being put in place because there could be some businesses in a state like Victoria where they had been ticking along okay, maybe not as well as they normally had, but ticking along okay until these extra restrictions, these extra lockdown rules had come into place and some of their businesses have had to shut down. So it's to try to catch those sort of businesses that would have otherwise fallen by the wayside. The other change to the eligibility criteria here goes to the actual workers employed by a business. For a business to get this subsidy, which at the moment is $1,500 a fortnight for every staff member they keep on their books, those staff had to be employed as at the 1st of March earlier this year when the coronavirus crisis really started to bite. The change now is that the worker has to be employed as at the 1st of July. So there could be some changes in the workforce, people getting new jobs or shifting into other roles that could have meant that they were ineligible for the JobKeeper wage subsidy, and they will now be covered by these changes. The Treasury is estimating that around 500,000 workers, an extra 500,000 workers could be covered by these changes. And of course, that does come at a cost, $15.6 billion added to the bottom line for the JobKeeper scheme as a result. But when we're talking about the broader economic impact of the lockdowns and the shutdowns in Victoria, it seems like a fairly small price to pay, with concerns many more people could be facing the prospect of losing their jobs. And Treasury yesterday saying that the lockdowns over the next 6 weeks will cost the national economy an extra $7 to $9 billion.
Matt, thank you. Let's go to Steph Ferrier in Melbourne. And the city has just lived through its first 24 hours of a full-force lockdown. How's everything going there?
Yes, good morning, Michael. Well, it's been pretty tough in lockdowns, coupled with that new business restriction and also 8 more deaths and 471 new cases. But it seems as if Melburnians are getting on board with abiding by these toughest restrictions yet. There are only a few other cars on the road when I drove into work early this morning, so it appears as if that nightly curfew is working to reduce movement around the suburbs, although the Victoria Police latest data that they've collated over 24 hours does show that 55 people were fined for breaching that curfew, 51 for not wearing a face mask, and that's among 176 fines that were issued by police. Now, businesses are also moving quickly into these restrictions, although warehouses for pharmaceutical and food distribution have been given until Sunday to comply to ensure continuity of supply. For meatworks, they will reduce their workforces by 1/3 for red meat, although poultry will only cut their workforce by 20% to avoid food wastage. And the rules have also been clarified around construction, with small home builds and renovations allowing up to 5 workers on the site, and tradies will be able to move to 3 different sites per week.
Steph Ferrier in Melbourne, Matt Doran at Parliament House, thank you very much. To other news, Queensland is preparing for a rush on its southern border, with the state set to reimpose a hard closure on New South Wales and the ACT from 1 o'clock tomorrow morning. Meantime, New South Wales residents returning from Victoria will now have to enter mandatory hotel quarantine for 2 weeks at their own expense. Authorities say all returning travellers must come through Sydney Airport unless they live within the New South Wales border regions.
Newcastle is on high alert after a man with coronavirus visited several pubs at the weekend and attended a local A-League match. The man in his 20s is a close contact of a Newcastle teenager whose diagnosis has shut down his high school and sent 2 football teams into isolation. Meanwhile, in Adelaide, more than 1,000 staff and students at a senior college have been forced into immediate isolation after a 5th person linked to the school tested positive. 70 people will be sent to quarantine hotels in the Adelaide CBD.
Victoria's coronavirus outbreak is presenting a big challenge for the state's federal MPs. Victorian politicians have been told they must isolate for 2 weeks before heading to Canberra for Parliament later in the month. If they don't, they'll miss being able to cast their votes. There are currently no active cases of COVID-19 in Canberra.
To New South Wales now, where authorities are under pressure to contain the spread of new cases in Sydney and Newcastle. Rani Hayman joins us now from Glebe in Sydney's inner west. Good morning. What's the latest from health authorities in New South Wales?
Good morning, Lisa. Well, the numbers of COVID-19 infections here in New South Wales have stayed relatively consistent. We've heard that 11 cases were announced yesterday. Those are associated with known clusters within New South Wales. We also heard that there are 2 mystery cases that New South Wales Health are concerned about. They don't know the source of those infections, but they are working to determine where those people may have contracted the virus from. One of those cases is a man who attended the Jambo African restaurant here in Glebe, which is where we are. This street is a pretty popular street here in Sydney's inner city. There are a number of restaurants along here, and there's also, it's quite heavily populated here with houses across the road here too. So that man attended this restaurant here. He also attended a number of other restaurants across the city. So there's concerns around that. Also, the other mystery case is a teenager from Newcastle. Now, this teenager is associated with another man who's in his 20s in Newcastle who's also contracted the virus. And we've just heard recently that there is another teenager who is associated with those 2 who has also contracted the virus. There has been 2 schools closed in Newcastle as a result of that. The man in his 20s also attended a number of venues around Newcastle. So the community there really is on high alert at the moment as to where this man went and exactly whether any other people within the community could be infected.
Yeah, no wonder authorities are encouraging everyone to wear face masks.
Well, that's right. New South Wales Health has reiterated their calls for people to wear face masks within the community. They say that they're strongly encouraging people to do that, but they're not making it mandatory just yet. Now, they're encouraging staff in retail and hospitality to wear these masks. They're asking people that attend gatherings for worships, people that go to the shops, people in densely populated areas to wear these masks. Now, the opposition has said that the reason as to why the government might not be making this mandatory is because we don't have a big enough supply of these masks. But the government has come back and said that, well, we do have 88 million masks in stockpile, so there are enough masks to go around, but I guess we'll just have to wait and see as to whether that does become a mandatory thing here in New South Wales, as it has in Victoria.
All right, Rani, thank you very much. Now to the last line of defence against coronavirus in Victoria.
At Footscray Hospital's intensive care unit, teams of hard-working medical staff are working long hours and putting themselves at risk to care for the increasing number of COVID-19 patients. Let's hear there now. We're joined by ICU physician Dr. Forbes McGain. Dr. McGain, thank you for joining us this morning.
Thank you, Michael.
Firstly, how many COVID patients roughly are you treating there at Footscray?
Yes, so in intensive care at Footscray, we have 6 here. We have a similar sort of number at Sunshine Hospital, and there are certainly others in the state, particularly Royal Melbourne and Northern, for example. Yes, it's a serious situation.
It is a serious, and patients, of course, have to be in a serious condition if they reach you in ICU. How parlous is their health by the time they get to you?
Yes, a lot of the patients are quite hypoxic. They have low oxygen levels, and they certainly need help at that point. I would say that very clearly, though, that some great work is going on well beyond the intensive care unit by geriatricians, GPs and other parts of the healthcare system to look after these sick patients.
And what's your assessment of the pandemic? Do you fear that it could get worse before it gets better?
That's a difficult one. I think that we're going to be seeing large numbers in Victoria for a little while yet, but we're hopeful that it will not stress the system too much, and we're able to contain care of patients within the confines of the intensive care unit. We haven't had to expand outside the intensive care unit, although there's been a lot of preparation and planning for that. So that's where it's been quite different, for example, to United States, Italy, England and other countries.
And Forbes, you and your colleagues there are at the absolute front line in trying to fight and beat this virus. What sort of precautions are you taking up, other than the fact that you're clearly kitted up at the moment? How careful do you have to be every day you go into work? Yeah,
quite careful. So the wearing, as you can see, a face shield, face mask, when you're dealing with the patients who have COVID-19 or suspected, wearing an N95 mask and gowns, gloves, etc. You can also see our device behind us there, which is also useful for protecting patients and protecting staff in particular.
I wanted to ask you about that prototype hood. Tell us a bit about it.
So if I just step a little bit that way, so you can see the device here. It's essentially a plastic cover with a fan. You can see at the top there going down just slightly out of view. There's a big filter. So it's a device that not only stops droplet spread from the infected patient, it also stops aerosol spread by scrubbing the air at a rate of 100 air changes per hour. The intensive care unit I'm in at the moment is about 6 changes per hour. That has about 100. So that's pretty exciting. We're very excited about Jason Monty, the Professor of Mechanical Engineering at the University of Melbourne, along with his team. Will, Max and Kevin, Jeff and the rest have all been involved. So it's been very, very exciting project, and we're gradually expanding out beyond Western Health.
Yeah, absolutely. Great demand for it. Hey, Forbes, thank you so much for your time. And can I, on behalf of all of our viewers, everybody watching, extend our thanks to you and your colleagues for the work you're doing at the moment.
Thank you very much, Michael.